Hey, this is Russ. Let's talk dentistry. Yeah, it was time for me to get back to the dentist. Now, I have been holding off going to the dentist, like many people have, because of the COVID-19 issue, right? And it has affected the dentists quite a bit. You know, patients are not going in, although some have told me that they have no problems with people coming in. But I have a gut feeling some people are holding off. Okay, I know I held off, but it was time to do it. So my wife and I made appointments to go see our dentist. Let me tell you real quickly about our dentist, and then I'll tell you a little bit why I'm making this video. Okay, we've been with our dentist for quite a while now, quite a few years actually, and she wasn't too far from us. She was maybe I'm gonna say 5 minutes from my home, pretty close. So we've been going there for a long time. We like her. So anyways, we ended up moving to a different home. And so she became, I don't know, maybe 25 minutes away, something like that. But we still continued to go to her. I mean, really, you don't go see the dentist all the time. I mean, once every 6 months, if you have some issues, maybe a little bit more than once every 6 months. But for the most part, once every 6 months is when we went in. And so we said, she's not that far. We can go. So we drove the distance until recently, with the COVID-19 issues and things happening. She combined her practice with another dentist who's now even farther. Right? So on the highway, now we're talking highway, it takes me about 35 minutes to get to her. But we continue going to her. This is the first time back to seeing her since the COVID-19 issues. But if you find a good dentist or a good doctor, you tend to stick with them. So we stayed with her. So, anyways, here's the interesting thing about dentists, okay, and this whole thing with our knee replacements. I don't know if you know, many of you might, but if you don't know, if you go to see the dentist, many of the orthopedic surgeons recommend that you take some antibiotics. Okay, so I had to take this. This is clindamycin. I don't know if I'm pronouncing that correctly. I could never pronounce these things right. Clindamycin, 300 milligram capsules. Okay, and you need to take 2 capsules by mouth 1 hour prior to procedure. Okay. And then 1 capsule by mouth 6 hours later. All right, so essentially 3 capsules you need to take. Now you have to do this every time you go to see the dentist. So we're talking teeth cleaning, whatever. You got to do this. That was never told to me when I got my knee done until afterwards. And then I asked my dentist. I asked my orthopedic surgeon, "Hey, how often do I need to take this for?" He goes, "For life." For life. That was never told to me. Now, the reason they do this is because they believe that you're going to get bacteria that's going to be generated in your mouth that could travel down to your knee. It goes to the least resistance, so to speak, and it finds the knee, and you could lose your leg. Now, that's what the orthopedic surgeons say. Let me put something up here that my dentist gave me just the other day. Now, it says, and I don't know where this is from, but this sounds like this is from the ADA, okay? So basically it says antibiotic prophylaxis prior to dental procedures. Now, according to them, they believe that relatively few patients really need the medication. And back in January of 2015, let me read this quote. In general, for patients with prosthetic joint implants, prophylactic antibiotics are not recommended prior to dental procedures to prevent prosthetic joint infection. So the ADA is saying you don't really need it, okay? But the doctors are saying you need it, because I've heard from other knee replacement patients, and they've said that they have to take it as well. So who's correct here? Anyways, the last time I had this filled, the dentist prescribed this to me because of the recommendation from the doctor. The doctor tells him what things, and then she has to write it. But she tells me going forward, I'm going to have to go to the doctor, the orthopedic surgeon, and have him write the script so I can get it filled, because the dentist isn't going to do this anymore, okay? Because this is actually something that the ADA doesn't actually recommend. So the question is do we do we really need to take it or not? Something to consider. I personally don't want to take it because, I mean, you're talking every 6 months you're going to have to get this done, and I'll have to contact a doctor all the time and say, hey, get me another one of these things, right? So they're not that expensive, at least when, well, we have a drug program with our insurance. A couple dollars. I don't know what it was. $5-6. I don't know. Something like that. It wasn't that expensive for my copay. But the point is I don't want to keep taking it. And according to my dentist, it could be a little too much if you keep taking it that much. Because she says this is actually a pretty high, powerful, concentrated version of the antibiotic. So, anyways, check with your own doctors. Find out what they think about it. And, if you have to point them to this video to let them read that article, do so. Find out if it's really important. Okay. Let me go back to my dentist. All right. My dentist has had some foot issues, and so she's had her own surgery things. I've had my knee issues. So the first things we talk about is, how's your foot? How's your knee? So we have our own things going on. But I enjoy going there. We have a good time. Anyways, find somebody that you trust. Go in every 6 months. All right. If you have a dental program, we have a dental program with our insurance, and they cover that. They don't cover everything, but the general checkup and the the teeth cleaning and everything like that, they cover it. So I figured, why not go in? So, anyways, stick with your dentist, right? And some of them are, I think, hurting a little bit because people aren't going in because of COVID-19, But, they mask up and everything. And of course, you can't wear your mask while they're working on you. But they do the typical precautions. You get the temperature thing on the forehead and all that, and social distancing while you're waiting, that type of thing. So anyways, I just wanted to bring that up to you guys and let you know that you should probably check with your doctors to find out if this is something you have to continue doing or whether you can stop doing that. Okay. You might be thinking that, hey, well, why not take it? But if you take too much of this stuff, that's not good for you either. And for me, since I go in every 6 months, that's twice a year I'm going to have to take this stuff. So given my lifetime, whatever's left of my life, that's a lot of pills to be popping for antibiotics. Something to think about. Anyways, if you like the video, go ahead and hit that like button, hit the subscribe button, hit all those things, and I will talk to you guys next time.